Suspected poisoning? The wrong action can make the situation much worse. In the next 90 seconds, learn what you should never do when someone may have been poisoned.
Don't make them vomit. First, do not make the person vomit unless specifically instructed by a poison control center or medical professional. Vomiting can cause additional injury, especially with certain chemicals or corrosive substances. Don't give food or drink randomly. Remember, do not give food, milk, alcohol, or other drinks as a home remedy unless a healthcare professional specifically tells you to. The wrong substance can worsen the poisoning or delay proper treatment.
Don't give home remedies. Never try to neutralize a poison with another substance. Avoid charcoal, oils, spices, or other home remedies unless directed by a qualified medical professional. Do not wait for symptoms to appear. Some poisons can cause serious harm before warning signs become obvious. Get expert medical advice immediately.
Don't handle the poison unsafely. Do not touch, smell, or taste the suspected substance. If safe, keep the container, label, or packaging for medical professionals. If the poisoning involved fumes or gas, move away from the area only if you can do so safely. What to do? Call your local emergency services or poison information service immediately. If the person is unconscious, having trouble breathing, having seizures, or rapidly deteriorating, treat it as a medical emergency. Do not make them vomit. Do not give random remedies. Get expert help fast.